Preparation is key. Do not wait when the mother is in second stage. Then you start asking yourself whether to call oxytocin. You are calling Hillary, and I'm oxytocin inhibition of it. That is not okay. You prepare. For the woman who is in labor, Najua, delivery, I will need the following 1, 2, 3, 4. Right? Now, Najib, you plan. That will help you build confidence and avoid panicking. Because if you took a second step, now you need a delivery step. Now you have delivery step. What will happen next? Start panicking. So when you prepare early, then you minimize the risk of you panicking. And by the way, when you have any emergency, don't panic. Neither do you panic. Even if you have everything right, you're likely to make the wrong decision, the wrong choice. Okay? So once you're prepared and the mother is in second stage, you encourage her to bear down. Do not be like how my mom and her team used to be. Well, not to accuse her, but midwives, for example, they used to beat her women. You gave a bad of that. Yes. That is why most women ended up doing the liver particular. Atakuja clinic vizuri 4 times, 5 times. Deliver anaenda wapi? Minga. Najua mtu anafanya Mungu ana massage tumbo, encourage mama, second stage anapatia chai na sukari nyingi. TFP. Okay? So do not assault women, okay? You can be firm, you can be tough without using or something. Okay. That element of supporting the perineum is very important. Why do you support the perineum? Huh? It supports the perineum, prevents. What causes tears? What part of the fetal body causes tears? The head. Any other child? Which shoulder? Which shoulder? Yeah. Most tears are caused by the posterior shoulder. So, remember, Angela said that later when she done delivery, you have to have an institute. One time giving. That's what called. This element of removing the cord is very important. So, at the time giving, you deliver the anterior shoulder. Of course, it's not like this in practical. Once you deliver the anterior shoulder, you do not tilt this baby. This posterior shoulder is going to cause most renal tests. So, tilt the baby up. By tilting the baby up, you're pulling away that posterior shoulder from the perineum. Remember, at a point in time, you're not able to support the perineum, and at the same time, pull out the baby. Okay. Yeah. So, very, very important. Just needed to highlight that we can actively avoid perineal tears. And in doing that support, sometimes you may end up with like a first or second degree tear. That's acceptable, right? But we do not like third degree or fourth degree tears. Just because we did not support the perineum, or we did not support the perineum adequately. Okay. Yeah, I think that is what I needed from later. Angela also mentioned about third stage of labor. To deliver the baby, placed on the maternal mother's abdomen. Right? Remember, we said we do what we call delayed or clamp. Okay? If you place the baby on the maternal, the chest, skin to skin, you're wiping the baby as it's stimulated. Right? If the baby is crying, if the baby is active, muscle tonic, don't be in a hurry to clamp the cord. How long do we say you can delay? Yeah. You can delay to as much as 3 minutes, cutting that short. Okay? How does that help? Yeah? What about blood circulation? The placenta holds a lot of blood. Okay? The placenta holds a lot of blood. So a lot of that blood now is transitioning from the placenta to the baby. Right? Of which, if you're going to clamp and cut immediately, we may still retain some blood in the placenta which will have gone to the baby. Okay? And in clamping and cutting the cord, do not milk the cord. How will you manage it? Do not do what? Just clamp one point, clamp next to it. Cut. Why don't you milk the cord? Why don't you milk the cord? By using a whip, tap what is to do, you'll clamp here, then milk on the baby side, and then clamp. Why don't you do that anymore? Not really much to do with the issue of the HIV and increased risk of transmission. That's because just clamp, cut in between. The assistant and then total go back in a man. Now, active management of that level, we call it antecedent. Why we call it active management? Because before we used to do what we call passive management, or conservative management. In passive management, what used to happen, after the mother is delivered, you have to wait for the cord to separate. You have to wait for the placenta to separate from the uterus. And how do you know that the placenta is separated? You'll see a gush of blood. You know the placenta is separated, then you pull it out. We realize we have increased cases of postpartum hemorrhage because of that passive management. And so that's why it was, we call the term active management of unsettled labor. What does it entail? But the baby is, after the baby is been taken away, you massage, within that 1 minute, even if the baby is still on the mother's chest, you ask your assistant to give oxytocin. Okay? You ensure that there is no twin. Within that 1 minute, you give them oxytocin. Before what used to happen was that after delivery of the anterior shoulder, the assistant was asked to give, okay? But not all women have done ultrasound. So it was realized that sometimes we deliver that first baby, mepeana oxytocin, cervix inajifunga, and second twin land. So that's why we say we must verify that there is no second twin. Give oxytocin. How much oxytocin? In 10 international units. How is oxytocin stored? Free. Tusipata oxytocin in idle because get in the moment oxytocin is room temperature, it is no longer potent. Okay? What we use in room temperature is a drug we call carbetocin. Has any of you heard of carbetocin? You've not heard of carbetocin? It's been introduced recently in the government Ministry of Health circles, available in cancer, still a bit costly, but in due course we believe it will be available to across the country. But for now we are using oxytocin. So for oxytocin, it's kept in between 2 to 8. You only pick it from the freezer, then paired. So assistant of your 10. Then after that now, you go to what we call control for contraction. Okay? You do not wait for the placenta to separate. You ask the mother to tell you when there is a contraction. So the moment you hear contraction, to make clamp your cord. I'm right-handed, so I hold the cord there. Okay? The left hand I know what we call countertraction. This countertraction is preventing what Selena was asking, uterine inversion. You do not want to get uterine inversion because it's one of the causes of severe miscarriage. Okay? So one hand will be here, pushing out the uterus or supporting, providing countertraction, while his other hand will be here, gently pulling the cord. Okay? When you're pulling, do not do this. Do not start changing gears. Do not put in reverse and forward. Just traction and countertraction. If you feel like it is still up, you're not able to come down, you'll be able to get it. Okay? You give it a few more minutes till the contractions are there again. Try again. By doing this, you are helping to manually separate the placenta from the uterus. Something which before we never used to do, we wait for it. And then once you deliver the placenta, as you've already indicated, once you do the placenta, you check it. After that, the third component of active management of third stage, massage the uterus. And that massaging the uterus is painful to the mother. Okay? This is the only time you are allowed to inflict some pain. Painful, but it's going to prevent their uterus from relaxing and therefore being. Okay? So you tell the mother gently, I'm massaging this with some pain. I'm massaging so that you will not bleed excessively. And as you massage the uterus, you feel it contract. So you massage for the next 2 minutes, after which you're supposed to instruct one of the caretakers. Because I did from there for 2 hours, you're supposed to massage every 15 minutes. If you are able to do that yourself, fine. If not, you instruct one of the caretakers on a motivation how to fight that. And just by doing active management of that stage of labor, we prevented women from dying from BPH. Before, we used to lose so many women from just postpartum injury. But we realized just by this active management of that stage, we prevent up to 60% of BPH from. Any questions?